Okay, here's some sobering information. Here in Michigan, 1 in 8 women watching this newscast right now will develop breast cancer this year. That number has grown dramatically because 20 years ago, it was 1 in 11 women. Now, we've all heard that early detection is key to helping stop this, but because of job cuts, layoffs, and lack of benefits, more women find themselves unable to afford mammograms. Up front, Local 4's Paula Tutman takes a closer look now at what's quickly becoming a public health crisis.
I want to show you something. Take a look at this right here. You see that light spot right there? That's breast cancer. And while this may not be you, it definitely affects you. Inside the radiology lab at Botsford Hospital, Dr. James Lydon spends his days hunting a killer.
Cancer has a dense or white appearance on the films. The margins of something that is benign would be smooth. The margins of this are shaggy. It's kind of scary when you think that could be your mother or your sister or your wife.
According to the governor's office on community health, this year, much like years past, more white women will discover they have cancer, yet more black and Hispanic women will die of the disease. The correlation is directly tied to the availability of health care. But this year, add something new to the equation. More women, period, will simply have breast cancer that goes undetected.
So I only make about $5.25 an hour, plus tips.
Meet Jessica Kroc.
I was doing a breast exam, and I don't know what it is. It feels like a lump, but I don't think it's anything. But I can't get a mammogram because I can't afford it.
The federal government gives the state of Michigan enough money to do free mammograms for 26,000 women of need. If you're number 26,001, you are out of luck. We did an informal poll at Jessica's Pontiac rooming house. How many women here do you think have never had a mammogram? Anybody?
I've never had. I had one. I need one. POH. I need one terribly.
Jessica, however, will be the very first recipient of a brand new program dedicated to filling the gap left by the feds. The Pontiac Osteopathic Hospital Riley Foundation has just enough money to do 252 mammograms. A drop in the bucket, but a drop no less.
So it'll be just a second, okay?
The foundation's director, Teresa Rogers, meets Jessica at the door and walks her through her very first mammogram.
Because there are so many needy women in the city of Pontiac, I know that we will run out of money before we run out of patients.
Jessica's nervous.
Hold your breath. And breathe.
She's already beaten cervical cancer, and now she has a breast lump. We follow her films to be read.
28-year-old female.
The doctor reads the films and personally delivers the news.
As we expected, you know, it's normal.
Good. Relief. Relief.
But you have to do it every year at that time.
Okay, that's the bad part.
It's a bad part. Okay? Good luck to you.
Thank you. It's a week's worth of pay for me, and it's really not a priority, even with me thinking that there might be something wrong. I would have to forego it because, you know, I just simply can't afford it.
Why is this your problem? Because ultimately we all pay when women enter the cycle of illness, treatment, and even death.
Then we're looking at increased demands on our insurances. We're looking at, just in the patient itself, we're looking at a lot of problems with them because we have to spend more money to maintain their health.
If you need a mammogram, go to our website, clickondetroit.com, for information on organizations that want to help you get screened. Paula Tutman, Local 4.
All right, thanks, Paula. And the key word at clickondetroit.com is mammograms if you want to find out more about this program or if you'd like to make a donation.